Hello and welcome back. Thanks for joining us today. In today's video, we are going to cover some basic ideas about oral health. Your oral health is vitally important. This particular area of health isn't promoted to the same degree as other areas. In other words, dental health isn't as talked about in relation to medicine in general. Make no mistake, taking care of your teeth and gums should be a regular part of your day. Doing so could save you thousands of dollars in dental care and possibly from emergency dental treatment. Here on this channel, we always believe prevention is better than treatment. If you are experiencing oral pain, then schedule an appointment with a dentist. They are doctors who specialize in dental science and the latest treatment methods. Now let's cover some ideas and concepts about oral health you should know. Now let's cover some reasons why your dental health is important. Oral health is a critical component of overall health and well-being. Poor oral health, particularly gum disease, periodontitis, has been linked to several systemic conditions such as cardiovascular disease, diabetes, respiratory infections, and even complications in pregnancy. Bacteria from infected gums can enter the bloodstream, potentially causing or exacerbating these conditions. People with diabetes are more prone to gum disease, and severe gum disease can make it more difficult to control blood sugar levels, leading to a vicious cycle of poor oral and overall health. Inflammation and infections in the mouth, particularly from periodontal disease, can lead to inflammation in the blood vessels, which is associated with heart disease, clogged arteries, and strokes. Bacteria from periodontal disease can be inhaled into the lungs, leading to respiratory infections, including pneumonia. Lastly, poor oral health can lead to tooth loss, making it difficult to chew food properly, which can result in poor nutrition and impact digestion and overall health. There are a couple of different ways to prevent poor oral health outcomes. Some dentists may offer differing opinions on the best way to conduct at-home dental care, but the general concept remains the same. Let's go over a few of those basic general rules to keep in mind when practicing at-home care. Preventing cavities involves a combination of good oral hygiene practices, dietary choices, and regular dental care. Here are the best ways to prevent cavities. Use fluoride toothpaste and a soft bristled toothbrush to brush your teeth at least twice a day, ideally after meals and before bed. Brush for at least 2 minutes, ensuring you reach all surfaces of your teeth, including the front, back, and chewing surfaces. Floss daily. Flossing removes food particles and plaque from between your teeth and along the gum line, areas that a toothbrush can't reach. An antimicrobial mouthwash can help reduce the amount of bacteria in your mouth and clean areas that brushing and flossing might miss. Lastly, sugary and acidic foods and drinks, such as candy, soda, and fruit juices, contribute to the formation of cavities. Limit their intake, and when consumed, try to brush your teeth afterward. Before we move forward, it's a good idea to cover basic teeth and gum structures you should know. Note, we are only covering the basic common terms you should be familiar with. If you want to learn more about these structures, then a good idea would be to study head and neck anatomy or ask a licensed dentist. Understanding the basic structures of teeth and gums is essential for maintaining oral health. Here's an overview of the key components. Enamel, the hard outermost layer of the tooth. It's the hardest substance in the human body. Dentin, a layer underneath the enamel, softer than enamel but still strong. Pulp, the innermost part of the tooth containing nerves, blood vessels, and connective tissue. The pulp is extremely important because it supplies nutrients to the tooth and provides sensation. The pulp is crucial for tooth vitality, but when it becomes infected, it can lead to tooth pain and the need for a root canal. Cementum, a thin layer covering the tooth's root. Root, the part of the tooth embedded in the jawbone. Now let's briefly cover some gum tissue structures. Gingiva or gums, the soft tissue that surrounds the base of the teeth. Gingival sulcus, the small space or pocket between the tooth and the gum. Lastly is alveolar bone, the part of the jawbone that contains the tooth sockets. It's generally recommended that you see a dentist every 6 months for routine checkups and cleanings. However, the frequency can vary depending on your specific oral health needs. Here's a breakdown. Most people should visit the dentist twice a year. These regular visits allow your dentist to check for early signs of dental problems like cavities, gum disease, or oral cancer, and assess your overall oral hygiene practices and provide advice on how to improve them. Some people may need to see the dentist more often, such as every 3 to 4 months. This could be due to gum disease. If you have a history of gum disease, periodontitis, your dentist may recommend more frequent cleanings to manage the condition. If you're prone to cavities or have many fillings, more frequent visits can help catch problems early. Conditions like diabetes can increase your risk of dental problems, so more frequent visits might be necessary. Lastly, smokers are at a higher risk for gum disease and oral cancer, so they may need more regular checkups. As we draw to a close on our video about oral health, there are a few things to keep in mind. As a side note, pregnant women should see a dentist regularly, as hormonal changes can affect oral health, leading to increased risk of gum disease and other issues. Maintaining good oral health is essential not only for a bright smile, but also for overall well-being. To keep your teeth and gums healthy, it's important to practice good oral hygiene by brushing twice a day with fluoride toothpaste, flossing daily, and using an antimicrobial mouthwash. Limiting sugary foods and drinks, drinking plenty of water, and eating a balanced diet rich in nutrients that support strong teeth and gums are also key to preventing cavities and gum disease. Regular visits to the dentist, typically every 6 months, are crucial for professional cleanings and early detection of any potential problems, ensuring your mouth stays in optimal condition. Understanding the basic structures of your teeth and gums helps you appreciate the importance of these regular dental visits. Your teeth are made up of several layers, including the hard outer enamel, the supportive dentin underneath, and the innermost pulp, which contains nerves and blood vessels. The gums, or gingiva, protect the roots of your teeth and the underlying bone. Regular dental checkups help monitor these structures, allowing your dentist to spot issues like cavities, gum disease, or structural damage early on. If you experience any symptoms like tooth pain, bleeding gums, or loose teeth, it's important to see a dentist promptly to prevent more serious complications. That will conclude our video on oral health. Feel free to like, comment, subscribe, and share our videos. Share this information with anyone you feel may need it. Thanks for your continued support. We greatly appreciate all of the support we receive. Help grow our channel in order to get this information out to as many as possible. Thanks again. We hope to see you in the next video. Until then, see you next time.